Thank you for the opportunity to share what I've been working on as an Ascend Fellow, an experience that I'm profoundly grateful for. The dissonance is striking. Today, the United States, the most prosperous nation in the world, is the most dangerous place in the developed world to give birth. American maternal and infant mortality, worsened by our country's traumatic history of racism, keep me focused on truth-telling and the dire need to create a new story. Today, an American mom is more likely to die in childbirth than her own mother was. And the crisis is far greater in communities struggling with the burden of racism. Our Black and brown sisters are dying at 3 to 4 times the rate of white women. And they report much higher rates of mistreatment and disrespect, all the way from being shouted at, scolded, or threatened to being refused care. And we face appalling gaps even in whether we can get maternity services. Almost 40% of US counties have no birthing hospitals, no birth centers, no obstetric providers, and that number is going up, not down. The economics of the US healthcare system are part of the problem. In general, providers are paid for the volume and the technical intensity of the care they deliver, whether that care is appropriate or not, regardless of quality. About 4 of every $5 of maternity care is spent on that brief window of hospital care during birth. Only a very small fraction goes to prenatal or postnatal care, when mental health, social needs, opportunities to improve outcomes are abundant. I believe we can write a new story. All the evidence tells us that patients cared for by people that share the same cultural background and similar lived experiences have better health and healthcare experiences. But patients of color often have a hard time finding a culturally congruent provider. Most of our maternal health workforce is white, though almost half of US births are to women of color. Changing the story requires moving from where we are, a severe shortage of obstetricians, midwives, and other women's health providers, to where we can be, a strong and diverse maternal health workforce. We need to invest in a workforce focused on the continuity of care, from clinical to community services. Making maternal and infant mortality a thing of the past will require radical imagination and radical collaboration. We need purpose-driven, meaningful, sustainable jobs. New pathways for people of color to become doulas, community health workers, peer mental health supporters, lactation consultants, nutritionists, social workers, nurses, home visitors, midwives, OBGYNs, professionals who provide evidence-based, equity-centered models of care. At the Burke Foundation, we've been supporting training and jobs with community doulas for the last 4 years, and the results are awe-inspiring. A 70% reduction in preterm births, and patients feeling supported and satisfied with their health care. We're beginning to invest in midwifery education for women of color and advocating with midwives to practice at the top of their licensure so that they're valued and fully integrated in the healthcare system. We're partnering with the New Jersey Department of Children and Families under Commissioner Byers' leadership to support nurses with universal newborn home visiting. Together, we can grow a perinatal workforce that creates a cycle of improved health and community well-being. I see us establishing a new healthcare system, one that's based on trust, on competence, belonging, dignity. I hope to never hear the tragic news that a mother or baby died because she wasn't heard, because she wasn't given the care that she deserves. Imagine a new birthing experience for a pregnant woman where she's cared for directly by her community, She's connected to resources she desires: nutrition, housing, transportation, economic support, every step of the way. She's listened to and respected by providers she chose. We owe this level of care to each mother and child, to all of us. To get there, we must support a perinatal workforce that has wages and benefits set at a level where providers and their families can thrive. We must invest deeply in the village of those caring for new mothers and families. My vision is to create a new core of perinatal leaders and to make sure that these crucial resources are available to all, not just the privileged. Yes, I want to be part of a generation that eliminates maternal mortality from our country once and for all. Thank you for joining me.